Welcome to another episode of Come Together. And we're rolling. Dr. Steinberger, how we doing? Welcome.
Doing
Thanks for
well.
coming
Thank you for
on.
having me.
Of course, man, of course. So, I usually tell people to tell me about themselves, but I was really excited when I came. So you reached out to me originally about ultrasound machine. And then I was like, hey, man, and I went on your website to just check if you were legit, especially through using Machinio. And I was like, well, is this guy a real guy? And I saw that you were a board certified anesthesiologist, and that but your practice is generally in kind of health related chronic health and recovery.
Yeah.
So I'm really excited to hear about your trip and to learn about the stuff that you practice, the medicine that you practice.
Yeah. Well, yeah. So I'm a board certified anesthesiologist, and then I did a 1 year pain fellowship in chronic pain uh, afterwards. And so I'm a chronic pain specialist, so I do run a pain clinic in South Florida. I know that can bring up some bad connotations uh, in South Florida, but it is a very specialty. Back pain is probably the second most common medical issue, and so it's a very common issue. Hard to treat, but yeah, that's what I do.
So why do you say it has a negative connotation in South Florida?
Especially in South Florida, there's a lot of Medicare, Medicaid fraud,
Hmm.
a lot of opioids that are used
Yes.
not responsibly. That really all started in Ohio, but South Florida's kind of just exacerbated the issue. There's a lot of, they're called pill mills. Patients come in with pain and they just give them scripts of Percocets or Dilaudid, and doctors go to jail for life for this stuff. And but it's very common, it's easy money, and but ultimately it doesn't help the patient.
I had a friend of mine that was on the podcast the other week, and the way I met him was he was a big advocate for ibogaine, and he told me that he told me that he played a lot of golf. I think he tore his ACL or a meniscus or something, and he went to the doctor, and the doctor was busy for the next month or so. So until then, he just prescribed him painkillers,
Mm.
and then so he took him for a month, and then he went in for got the surgery, whatever he did, and then he got another couple of weeks of painkillers, and then he started coming back. He's like, I have these withdrawal symptoms. And he's like, yeah, you're a drug addict. And he's like, I'm a what? He's like, yeah, you're an
Yeah.
opioid addict. I'm sorry, you got to go to rehab. And he's like, what the heck is that about?
Well, I even remember this in medical school. Which is true. They t told us that 1 out of every 6 patients that takes opioids for more than, I believe it was 2 weeks, just 2 weeks, 1 out of 6 will become addicted. They're
Wow.
very powerful. I I do not prescribe long-term opioids, strong opioids like Percocet. I will do them for a short course, like 10 days to get over a hump.
Hmm.
But in terms of chronic pain management, they've been shown over and over again that they do not help pain, make pain worse. They wind up the nerves, so you just get more and more pain. They weaken your immune system. They can actually cause some osteopenia, weakening of the bones. So they're really not
Really?
good long term. Yeah.
Wow. Wow. So, all right, so let's dive into a little bit. Anesthesia is a very prestigious, field of medicine.
Yeah.
Um,
I'd say, yeah, we kind of like the referees. We have to be quiet. If we do our job well, we just, nothing happens and you don't hear us.
yeah, that's right. And then, And why'd you just? And I'm sure. I mean, to specialize, how long did it take to? How much of med school did it take to?
Um, so I was interested in research during med school, so I took an extra year. And what actually brought me to pain is orthobiologics, regenerative medicine. But the whole training itself, I was in school in training for a total of 15 years.
Holy cow!
Yeah, I did 5 years. I did my MBA before med school. I did 5 years of med school, intern year, residency, fellowship, which all total were five. So 15 total. Why I chose anesthesia, honestly, I didn't know what I wanted to do in med school. And I did not match because I wanted to do ER. I did ER last minute. I changed because I
Wow.
couldn't do ER. I was in Atlanta and they're a huge ER. They had prison cells in the ER. It just is too much. So I
Hmm.
changed last minute. I didn't match. I uh, I just called up a program in Las Vegas, and they had just opened up, and they said, "Yeah, we're still looking for people." This was the day after. It was probably the most stress I've ever felt. I didn't
I could
match
imagine.
4 years, 5 years of med school. We didn't get a job. So, but I called them up, cold called them, interviewed. Next day, he sent me the contract. I ended up in Las Vegas for residency, and they just so happened to open up an anesthesia residency. In med school, you don't get much experience doing anesthesia. It's not a sexy profession like plastics or dermatology or ortho,
Mhm.
so it's not a required rotation. I did it, and I really liked it, the pharmacology, the physiology, and it's very procedural. So I liked it, and it was an easy transition, and I stayed in Vegas, and Vegas is why I'm in Miami now. So yeah, I guess it all kind of worked out.
Where are you from originally?
Um, I was I did my school in Kansas,
Hmm.
but I've kind of lived all over. No, my parents were in medicine, so I was born in Michigan. I lived in New Orleans for a little bit,
Wow.
and yeah, I ended up in Kansas for a good amount of years.
And how'd you like Kansas?
Kansas is quiet. Is it quiet now? I was ready to get out. It's if you want to raise a family, it's a good place. Now my
Yeah.
family's in Charleston, South Carolina,
Cool.
which is
A
more
little closer.
vibrant. Yeah,
Yeah.
yeah.
Definitely more vibrant for sure. What? Okay. And so you started with an MBA. Why was that?
Um,
Or what was
so
it? What was it the concentration in?
I actually just did general. I didn't do any finance or healthcare. I kept it general. I chose it because in undergrad I was a biochemistry major, and I had finished biochem. My I had finished my whole college, and I felt so sheltered and one-sided. I didn't know anything about business, my interpersonal, my presentation skills, communication. I didn't know how the world worked in terms of assets, liabilities, and so I knew I needed a year off. One, I was very burnt out, and I wanted to learn more about business and just working on the software communication skills. So I did that for a year, and that was what my driving impetus
Did
for.
you would you find that it was valuable? Did you find
Uh,
that the MBA was worthwhile?
100%, you can't quantify it on paper, but in terms of my development, I think it was very helpful. I really pushed myself. I joined a Toastmasters presentation group. I started taking salsa classes. I started doing a lot of different stuff just to like volunteering opportunities. So I just work on my really people skills because I
Yeah.
just felt so. I was around science people for 4 years, and I felt so not developed in that regard.
Wow. Wow. It's cool of you to notice that, by the way. And it's cool of you to try to take that risk and try that out, because
Yeah.
it's something that's really daunting to a lot of people, that like, oh, I guess, that's a whole part of my life that I'm not good at. Well, I guess I'll just avoid it, it stinks for me.
Yeah.
It's good to do something about it.
Yeah, I appreciate it. So yeah, it was useful. 100%. I think just getting out of your comfort zone is good in general.
Yeah, it's funny that you say that about on paper how it wasn't as that it's more valuable than experience than paper because I felt the same thing. I got a creative writing and literature degree, which
Yeah.
obviously on paper is not going to do very much for you. But I think that a lot of the skills that I just developed as a human being, came from that because one of my teachers, the first teacher that I loved, that like really got me into English, told me a great writer or a great create storyteller loves at least 50 things more than writing because you need something to write about. You need to have like passions in life. You need to have things that like light a fire under you that like make you want to capture that. And he's like, if you guys don't do anything with your life except for just write, then like what kind of writer are you going to be? So you have to love it. You have to prioritize so many things, and writing just has to be consistent.
Exactly. That makes me think of the author of Old Man and the Sea. I can't remember his name. Um, but he must have lived the most adventurous, exciting life, and he just wrote about it. I really need to
Yeah,
know.
the Old Man in the Sea. I'll
Yeah.
look it up after. I could even post it in the show note captions. I like to, whenever we talk about particular books or topics or ideas that I could like share that people could reference. I like to post that. So
Yes.
we'll find that after. That's awesome. So what was med school like? What was it? What was your experience? Where were you?
Oh, med school. I was at the University of Kansas.
Cool.
Uh, it was. It was difficult. I I did have difficulty with medical school. Just my
With the
mind
schedule, with the material, with the tests, with what?
My mind works. It was really, the schedule's fine, the long hours are fine. It was just, it's pretty much rote memorization.
Hmm.
As a biochemistry major, I'm more mathematical and I like to synthesize and analyze problems. So biochemistry, I was doing physical chemistry, physics in undergrad, and that was much as you synthesize information. Med school, you just regurgitate and vomit information. You must hold a lot of information at once and then put it out. And so just a different style of learning, which is less critical, but it's how med school is. So I just found it difficult. I got through, obviously, but it was tough, and the clinicals were very difficult. You are working 12 hours a day, you come home and you study for your shelf exams every month. And so you're pretty much effectively working 16 hours a day. I worked out. I would still have some time. I do 1 hour a day. I would do salsa dancing or something for that 1 hour, and I work out. Besides that, it's physically physically exhausting, but it's emotionally and mentally exhausting.
Yeah.
Always being criticized, always being the bottom of the totem pole, it's tough.
Do you do you think that there's a reason for that, and do you think it's the most effective way to kind of train? Like, oh, and also, how much of the information that you force yourself to memorize do you retain?
Uh, I do find the learning useful. Uh, I do find that the information we were taught in med school is useful, but I can't say that it needs to necessarily be 4 years. The intensity of it, there's so much information that you could only touch a surface on some of it. I do think it is necessary, but I think it could be changed. It could be changed how you approach it. Having said that, the issue, if you make it easier, I think it's just going to attract more people who aren't necessarily ready
Yeah.
for the commitment. So I think the good thing about it being rigorous and difficult to get in is it weeds out people who are not committed to the path. It's a long path, and I get it. If you're not in med school, you'd be working somewhere else, but it's different when every day you're made to perform and you must perform above a certain level or you're kicked out. So you must perform at a high level for pretty much all of residency and med school or else you are let go. So I think it's a good and bad.
Yeah, yeah. That's the most compelling argument that I've heard, is that it really weeds out a lot of people. Um, I think that the biggest challenge that we're going to have going forward is figuring out how to create a new med school system with AI.
Mhm.
And to figure, like, part of the value, I was talking to a friend about this the other day, part of the value that people used to place in education is how much information you can retain that you have disposable at your fingertips, and that's part of what the value is that you have over everyone else, is that you have all this information that you spent X amount of time and X amount of hours accumulating that no one else really has. And that, like, even if you read it somewhere, is it peer reviewed? How's that, how legit is it? There's a lot of garbage out there. How do you figure out how to, sort it through? And, like, you really do need a professional to be able to, to do that. And AI kind of just, like, mixes the whole thing up in the sense that, like, the amount of time it takes to get the amount of information, that would ordinarily take years could take, seconds.
Yeah. No, I think you're right. I mean, they now have the Watson IBM as a computer that can pass the medical school entrance exam and I believe it's a board exam now for
No way.
residency. But there there is a hospital in China now that has robotic physicians. That's almost, I think, fully AI robotic. I don't know exactly how it works, but I think that AI has definitely has a place more than some people would like. Uh, I still think you need a physician, someone who
Sure.
oversees it. I think it'll like bowling, it'll keep you in the right direction, but you still need someone to supervise it and make sure it's adequate.
Right. So the skill set of what you'd be learning as a doctor when you're going to med school would not necessarily be to be the AI to have all the information, but it's how to direct it, how to manage it. Like you almost become like an AI manager that's a medical professional, as
Yeah,
opposed to just spending your time just studying, studying facts.
that's true. At a certain point, though, you said, do you even need to be a doctor to do that?
Yeah, that too.
So I don't know if, I mean, no one can predict what will happen. I'd
Yeah.
be interested to see.
I've been saying a little bit now. The thought struck me when I was doing a podcast with oh my god, I'm gonna be so upset if I forget her name because I liked her so much. Is gonna Allison Levitt, and we were talking about how there should be doctors of medicine and doctors of health, and like like there's doctors that like prescribe that you come to once you're sick and once you need like some kind of medication, and then there's doctors of health that kind of every step before that step, how do you stop
Yeah.
someone from getting to that point? I mean, myself, for example, I have you started talking about lower back pain, or back pain in general. I love a little bit of lower back pain. I have a good buddy of mine that's a chiropractor, and he gave me a couple exercises to do at home, and he's like, everyone just needs to strengthen their back, like you just and also the way that I'm standing and the way that the way that I held myself, my
Mhm.
posture, all had a difference. And I just need someone like that just to tell me like, hey man, you're being, this is to be healthy and you need this to be healthy. You need these vitamins and this, diet and hopefully you won't need a doctor. But if you do, then here's another doctor you can go to.
Yeah. I think it's what's happening to the airline industry with pilots. Most pilots, the takeoff, the flight is all it's autopilot. And so
No
how much
way.
actual human human involvement is I very little on a commercial flight, but you still at this point need a pilot to make sure everything goes right and to account for any mistake or if the system fails. So I think medicine is going the same way. I know for anesthesia, they do have robots now who can intubate. They can intubate patients. And
Wow.
some, they've even tried to administer, some can administer medicines, but we're still not at the point of full autonomy. With procedure-based healthcare, I think it's difficult to be full autonomy. Surgeons are using the Da Vinci robot every day to do most procedures. It makes it cleaner,
Hmm.
but I don't see a point yet where you're fully automated. That's a scary day. When you are, you just have to pay everyone a basic
Well,
income, I guess.
yeah. So the automated date, I don't think is that. Listen, it's in the future, but I don't think it's a very distant future because all you got to do is take those robots that Elon's working on, those Tesla robots, and all you got to do is put an AI chip in them, and then all of a sudden they're a walking version of an AI that can that has the physical capabilities.
Yeah,
That's not too far. I mean, that can't. I mean, was that? Let's say crazy 50 years. I mean, 100 years. But that's not even that. The pace that things are moving.
yeah. I mean, the idea of singularity is as technology advances, it advances at a faster and faster rate. I think, what, 100 years ago, we were still with a horse and buggy, and now in 5 years, we've got well, who knows, 10 years from the computer to AIs, the jump has
Yeah.
been even quicker.
Yeah, yeah. So we'll see what happens. It does freak me out a little bit, especially when like I feel like the blurs between like what could potentially be reality, like what AI creates and what's not, starts getting harder and harder to differentiate. But you can't
Yeah.
think too much about it or you can't sleep. I mean, it
Like,
really freaks the hell out of me.
there's that meme that's going around that I tell ChatGPT thank you every time, so when it takes
Uh-huh.
over the world, it will spare my life.
Dude, I am so polite to my chatbots. It's so funny. I'm like, please, can you break that down simpler? I don't understand. I appreciate your time. Thanks. Like,
Yeah.
just don't kill me later.
I mean, I think I don't know. There might be some truth to that.
I don't think it's out of the picture. I don't know. And I mean, can you imagine? I mean, do you ever remember the book? I don't know if you ever read it, but not even a Brave New World, that too. It was a Brave New World, yeah, where
Uh,
like humans are just grown in gestation, and like they're just they're just, like these embryos are just placed into different uh social and physical hierarchies based on like whoever the creator decides that they're going to be,
mhm.
and like, okay, so your embryo is going to be stronger and taller and more athletic and smarter, and then you're going to be the plebeian that's going to be shorter and dumber and not even capable of thinking of even wanting a better life,
Yeah.
and like that's just what the life that's just, and like, and Aldous Huxley, if you like if you Google the year that he came out with that book, I forgot what it was. It was early. It was, I think, maybe the 40s or the 50s. If you Googled what technology was at the time, like it was nothing, and like he could already see where things are heading. So like, I don't know, man. It really schemes me out.
Yeah, it can be scary but exciting. There are so many things now in the world that it can go so many different directions.
Yeah, yeah. What gives me hope at the end of the day is that like we live in a pretty benevolent, like we live in a
Mhm.
world that like things are generally like we aspire for good, and good always kind of feels like it's trying, like it's like pushing out and emerging, and like
Mhm.
I think that like is so common for so long in so many different aspects of life. It's so interconnected just through everything that like I think the universe is built to support life, and like life is good. Like that's what goodness is. So
Yeah, I I I liked it. I heard this quote that said we have fundamentally our issues are the same as they were 2,000 years ago. We have
Mhm.
just right now we have godlike technology.
Yeah.
We have medieval laws, but we still have reptilian brains. A lot of our issues are made from our differences. The
Mhm.
differences we have in our communities, our religions. That's what really is pushing all this. The fear is that we use the technology to justify these reasons that are from the caveman era, that we have to almost work on ourselves and then we can improve our society.
Yeah, totally. I believe that religion is the consciousness, the evolution of consciousness. I believe that like the general concept of trying to strive beyond our, primal animalistic nature, and like and invest in a future world for better times and better community or better, family or
Mhm.
whatever it is. I feel like that is like like there was a certain stage of evolution that was physical, and then at a certain point, the next wave of evolution to kind of like
Mhm.
manifest is through our consciousness, and like we
Yeah.
have to you have to shed that kind of primal animal, reptilian aspect of us, and like truly just be conscious,
Mhm.
um which is kind of it's recurring throughout a lot of different religions and ancient tribal stories, and like ideas of like collectivism and like one consciousness, and like people take psychedelics and they see all these experiences where everything is one, and you're like, well, it's everywhere, like, I mean, maybe it's not the complete truth, but there's got to be, aspects of truth that are definitely sprinkled in there.
Well, I think even scientifically, we are all connected. We are really are all stardust. We are compressed atoms from the sun, where we are part of suns that have collapsed and have created heavier elements. Most of our bodies are carbon, hydrogen, oxygen, the organic elements. And so we really are just all the same. We're connected. But
Yeah.
that's on a scientific basis. But on a spiritual basis, I get that too. It's hard for people to come together, accept a lot of facts that they see differences in.
Well, that's the point of the podcast, I hope,
Yeah.
and I think that it's funny because there's definitely a cycle, between like, I guess you could call it, authority or establishments, and then abuse of power, and then it collapses and then builds back up again based on like a new level of trust, and then somewhere along the line it collapses. Like it's constantly cyclical. But I
Hmm.
think that the ripples that happen become bigger and bigger ripples, and the and the breakdowns are bigger and bigger. I think the COVID breakdown was like a global breakdown, and now there's a global. It feels like, at least there's like, at least in the country, but I don't know about I really don't know much about the rest of the world,
Hmm.
but that there's like there's a reassessment as to like hey man, like what's really the story about anything? Because like we don't know what to believe anymore, you know,
Yeah.
and like that's good. That keeps us looking for truth, and
Yeah.
then we could rebuild our trust as we see truth kind of pop out into all the pile of crap that's there.
Yeah, I just think as humans individually, we're not very impressive. It is only when we work together that we can make phenomenal, fantastic advances in science, medicine, math, religion, whether it be the airplane, the computer. But the issue is, once you get so large, humans are very distrustful of large
Hmm.
organizations and governments that seem to have authoritarian power. They're very distrustful of that. So
Yeah.
there's a yin and yang to.
Yeah. Yeah. There's something. Yeah. It's so funny you say that because I don't know. I haven't figured out how to get past this really, and I don't know if we can. I feel like humans operate best, or at least my experience is that I've operated best in smaller communities and smaller sects as opposed to bigger, like I've lived in Manhattan, and I've lived in Binghamton, upstate New York, and
Mhm.
like what I've found, generally speaking, just in all the different places I've gone, uh, even for my own life, is that I feel like with in a world, I thrive in a smaller set of familiar people as opposed to a big rush of crowds where I don't know who's going to be where at any moment, and if I don't if I'm going to recognize anyone at any point.
Yeah, and I think I've heard that you can really only have your circle, your community, what, 50 people? That's really what the humans meant.
Yes,
These
that's right. That's all we
large
can keep track of.
organizations. In New York City, I have a lot of friends in New, or had a lot of friends in New York City. In New York City is a lonely place. Everyone is in their own life. They don't
Mhm.
interact much with each other. They like their own. They have their headphones in the subway. They don't really interact. So it's a lot of people, but all my friends would say it's lonely here. People
Yeah.
are lonely. They have their dogs. They keep them company, but they live solitary lives. It's the
I don't know
small
if this is,
communities that
I
they
don't
don't.
remember if this is still accurate, but as of a couple of years ago, I think the average household in Manhattan had two dogs and 1.5 children.
Yeah.
And and people were just more inclined to like, I think that, I mean, I'm sure it speaks a lot to the demographic too, that
Mhm.
typically cities are filled with young people that are, commuting and okay with apartments, and they're looking to just be close to work, and then so like I do hear that there's obviously going to be biases in that staff, but like it's still pretty crazy to me that the dog rate, the rate of dogs that
Yeah.
we own is more than the amount of children that we're willing to have. Um, let's go. Let's talk a little bit about medicine. And so you finished anesthesiology in Vegas. First of all, how'd you like Vegas?
I love Vegas. Obviously, I like big cities with a lot of energy. I like the energy,
Yeah.
and it's a no judgment place. Obviously, in Vegas, you need to have discipline. I knew residents who got lost and they dropped out, got kicked out of residency. Vegas has a lot to offer. I really liked my classmates, the people at the hospital. Awesome
What kind of
people.
stuff were you doing in the hospital?
So I was doing my first year. I did a transitional year. So I did internal medicine, general surgery, some dermatology, and then I did anesthesia the last 3 years. And I was at 5 different hospitals in Las Vegas.
Wow.
Yeah, I was there during the shooting when they had that large shooting there.
No way, really? That
Yeah,
was 2014, 2013?
that was. I can't, I think it was 13 or 14, but I don't remember the actual year. But yeah, I remember it happened towards the end of the night and they were moving patients from one hospital to our hospital because they had to make room in the ER. So yeah, it was a large event.
That's crazy. Is an anesthesiologist? They, I don't know this because my wife just went through this a couple of weeks ago. They do the what's that painkiller that they give women that are about to give birth? It's not. There's that big needle that they send all the dads out because they're afraid they're gonna pass
Oh
out.
yeah, they do epidural. They
The
do an
epidural.
epidural
Yes, yes,
or
yes, yes.
spinal. That's what I do in my pain clinic. I do the cervical, the neck epidurals, or lumbar epidurals. I used to do the OB epidurals. I work at a hospital here in Miami Baptist,
Cool.
and so I work in main OR. But the labor epidurals, the OB, is very satisfying to do. But those labor epidurals, as opposed to what we do here in the clinic, we have older patients with hardware, so we use X-rays to find the needle in the spine. They do it blind, so and they But younger females are very
Why would they
easy.
do? Why would someone do it blind as opposed to using needles? Not
What
X-rays, rather. Sorry.
one for habit, just tradition. Pain medicine is outpatient clinic. The patients are older. They have spinal hardware. The spaces you have to enter are much smaller,
Uh,
so you have a less room for error. And so that's why they do it in pain medicine. Just because, also, if you're doing an epidural in the neck, you want to be very precise. There's much less room for error, so you want to use an X-ray. When you're doing it for laboring women, it's always at the L4-5 or in that lumbar area. They're sitting up. The space is very wide open. They're young, so you can feel the ligament. You can
mm,
feel like where you're at exactly. As you age, as the ligaments can become more relaxed, you can't feel where you're entering. So that's why.
I see. And when you do a lumbar epidural or something like that on an older patient, that's is that the same thing as is that the same medicine as epidural that my wife was getting? What's the difference? How
No,
does that work?
usually in the epidural, laboring epidural, they'll use bupivacaine, some fentanyl, this to give you some. So one, for the bupivacaine, you won't feel anything, and the
Mhm.
fentanyl will relieve any pain you do feel, provide just some general.
Quite a cocktail.
Yeah, exactly. In our clinic or any pain clinic for an epidural, they'll use steroid, which is anti-inflammatory, and then a small dose of Marcaine, bupivacaine, that just it's for short term, like that
Hmm.
day. But the real medicine is the steroid, which
That's
works
so
over
interesting.
months. Yeah, it's anti-inflammatory because the nerves are very inflamed, so you want to calm them down. Whereas in laboring women, the nerves are fine, you just want to numb them up.
Yeah, you just want to make sure that she's not feeling anything going on there.
Yeah.
Because my grandfather had back pain, and he would go and get injections all the time, and I would always ask him, I'm like, "What are they injecting you?" And he's a GI, I
Mm.
mean, and it's like I don't even know. I think he maybe even told me steroids, but I didn't even know what it meant, and he never explained it to me. But like he would go, and then you get this relief, and I'd be like, What are they even doing to you?" So it's good to know. It's good to know. That's why people buy ultrasounds, right? To do that needle guided inject those needle guided injections
Yeah.
a lot.
And so for those for ultrasound guided, that's more for peripheral joints. And you can visualize with ultrasound even better than fluoroscopy. X-ray, you can see tendons, you can see muscle. And so it's very good for not only steroids, but now as we're approaching this regenerative age, you can do plasma biologics. So it's easy
Yes.
to get into those tendons.
So let's talk about that. I wrote a bunch of words down that I don't know what they meant in your website
Yeah.
of treatment that you offer. So I'm very excited to learn about them. Um, Plasma therapy.
Yeah. So we mentioned South Florida. South Florida is a hotbed also for this, I call it false advertisement for regenerative medicine, which was my research interest stemming back from undergraduate. The regeneration of tissues of the body, which animals in nature, the salamander, axolotl, they can do it. The body's capable of doing it, but the promise that we offer patients that it's called regenerative tissue. We're not regenerating tissue on a clinical scale, not in
Okay.
clinic yet. It's anti-inflammatory. In academics and studies, yes, we're regenerating. And so the idea with plasma you mentioned, platelet-rich plasma, they have found that platelets, when you centrifuge it off, there's growth factors in those platelets that if you re-inject it into the body, it provides some anti-inflammation and hopefully some healing potential.
Hmm.
Whether that healing now is our bodies is fibrosis. When you cut yourself, you develop a scar. When you
Yeah.
get surgery, you have scars in the abdomen, adhesions. So our bodies form scars, but young kids, neonates, when they're cut, they don't form scars. They regenerate tissue. So the whole aim of this whole field is to, for instance, if you have arthritis in the shoulder, right now we put steroids.
Hmm.
They want to regenerate that cartilage. The reason you have pain is because there's no cartilage. It's bone on
It's rubbing
bone.
together, right?
Exactly. So you want to regenerate that cartilage. That's the holy grail. That's the goal of this regenerative therapy.
Why can't
And
we just insert more cartilage in there?
because the cartilage is one, it's avascular. It's very hard to grow in a lab or to even to grow.
Okay.
And then to
Okay.
keep it in the body is even harder. To keep it there. So
If
there's
you
trial.
re-nourish it, if you find a way to re-nourish it or quote unquote regenerate it.
You could probably grow some cartilage in the lab, but to keep it, the joint space is a very harsh environment. It has to stay there. You have to find a way for the interface between the bone and the cartilage. And that has to be like glue. You can't, because you can just stick a plate of cartilage in the shoulder, but it won't stay there. You have to
Right.
find a way to keep it stuck to the bone.
And the technology is not there yet for that.
We're not there. So we're promising, people are promising regeneration. It's not regeneration yet. It's restoration. We're
Sure.
anti-inflammation. And I mean, would I personally do these biologic? Yes, but I'm just not going to believe it's regenerating tissue.
Right, right, right. So typically speaking, your patients are a little older in your practice?
Yeah, as we age, yeah, we get more arthritis, our bones, more wear and tear. So yeah, but a lot of patients who want their regenerative therapy are younger athletes. Kobe Bryant was one who was getting PRP for the
Right,
first
right,
time
right.
in Germany. So athletes want it, and for younger patients, I would recommend PRP because the
You would?
steroids, yeah, steroids, they can cause, if you inject in in the fascia or tendon, it weakens it actually. So you can have, it makes it more likely for a rupture. Um, a lot of the ablations we're doing for the neck or the back, they they ablate not only the nerve for pain, but the nerve for the muscle. So you weaken the neck, you weaken the lower back. And so it's not something you want in a young, active person.
Wow, interesting. But so why would you give it to an older person if they have a harder time recovering?
So you give it to an older person, one, because the goal for an older person is to just maintain mobility. You want to make sure just get them over the really painful hump. You don't want to be doing these procedures all the time, ablations, steroids, but most of the time this pain is acute. Maybe the 6 weeks you want to get them over that hump, and the goal is to continue mobility. The
Uh-huh.
motto of our clinic is restore and maintain an active life. If you stop moving, your joints fuse. And when your joints fuse, you get more pain, you can't move, and you just create more problems. So
Yeah,
even if you have pain, you want to move a little bit. You just keep the joints need movement for lubrication. You just need to
yeah,
keep moving.
yeah, yeah. I know, and we do very, very little of that these
Yeah,
days,
become more,
unfortunately.
yeah, exactly.
So are you seeing a younger demographic come in for like old, typically old, like what would have been considered older deterioration or deterioration that's more common when when you're older?
No, young people or most people in general, most of these procedures for PRP, exosomes, they're cash pay. So
Ah, I see.
most people don't want to spend disposable cash on a pain procedure. They want to spend it on a cosmetic procedure or
Right.
something that they can see that pain
Yeah.
is not sexy, it's not fun. So they don't, yeah.
So the PCP is our blood have platelets in it. You cycle it. You take it from the particular area where that's already in pain.
No, you put an IV in and you get out 50 cc's usually of blood. You put it in a centrifuge and you spin it for a few minutes and it'll separate the blood with the plasma and the serum and you take the a layer and that
Yeah.
layer has the platelets with the growth factors. And
And you add
that
that in.
you get that and then you give that back in the body.
So you're putting their blood back. It's almost like enhanced blood with extra. So the
Exactly.
PCP stands for what?
PRP,
PRP.
platelet-rich plasma.
Gotcha. Gotcha.
PCP
Gotcha.
is primary care provider. That's your
Oh,
main doctor.
okay. Gotcha. Gotcha.
Yeah.
Gotcha. Right. It's a lot of what do you call it? Shoot. What do you call the three
Yeah,
letter
acronyms.
things?
A lot of
Acronyms. Thank
acronyms.
you.
And so
Yeah.
now
Seriously.
we have the PRP now, and now we have the next generation of PRP, which is called exosomes, which now they have found exosomes are simply the PRP with a transport vehicle that allows it to enter the cell. And so now they've found that these exosomes, they can concentrate them, and it's even might be more beneficial than PRP.
So let's say with the original PRP case, you're kind of flooding that blood back in your system and you're hoping that the cells take it because it's new blood in. With
Well,
exosomes, it's more inclined to latch on or hang in.
yeah. Well, PRP, you're not giving back in the IV. You're injecting it into the area of pain, in the
Oh,
back,
cool.
or in the shoulder, in the knee. Same with the exosomes. You take the blood out, centrifuge it, and then you get the exosomes, which are just the growth factors in the transport vehicle. And
Yeah.
so it's the lipid bilayer, and it just enters the cell more easily.
Isn't that how hair transplants work? You take like the hair that's like growing from one area, and then you pop it into the root, and you pop it into the area where the hair is not growing, continuing to grow.
That they use PRP and exosomes they use it for hair loss. I don't
No,
know
no,
of
no. I'm not
people
talking about using PRP for that, but I'm saying the similar concept in the sense that like you're taking the
oh
good growing hair from one area, and you're popping it to another part of your head and hoping that it grows there. By the way, my dad did that. It didn't work for him at all.
yeah,
So.
I don't think I could no. I mean I've seen people try, but no, I don't think that's more like a transplant because you're taking hair from a good area and putting it into a bad area. The exosome, the idea is it doesn't enter the shoulder because blood doesn't get there, and so to get good growth factors there, you have to inject it because
I see.
cartilage is avascular and you
Right,
can't get the blood there.
right. Cool. And is that so? When people walk in, are they asking for that, or are they coming in pain, and you're making recommendations based on like what their pain is?
I will make recommendations. There are some clinics that specialize in that. The issue is I didn't want to specialize in that because it's not the level of being able to, in my opinion, be on its own. It should be combined with, I don't be charging patients cash. I mean, some of these procedures are $3,000 and we
Hmm.
have limited evidence that they even work. My my belief is that we can do the standard procedures that have been shown to be effective. Even them, even those aren't evidence-based, but at least they're covered by insurance. They're not super expensive. And
Right.
if they don't work, we could consider PRP or exosomes. But I don't want to have to push patients to a procedure that might not work. And so I like to offer everything.
Right. Right. How'd you become so open-minded about this?
Um, I don't,
Because it's pretty niche, I think. No.
it is very niche. It was just the idea of the body regenerating itself was fascinating for me in medical school, so or in undergraduate. So it was never about creating a business model or promising something false. It really was about getting to the
Yeah,
point
sure.
where
No,
we
yeah,
could
for sure. I believe that.
help. I guess I I can't say that medical school developed it. I think you just have to be open-minded and just know it sounds basic, but I think that that's it. You just realize that if you really want to help, you're not helping by falsely promising stuff. You have to really make sure it works and make sure it's evidence-based.
Yeah. Yeah. I guess and I mean, and does evidence grow based on like if you're successful with X amount of patients, right? Are you like, I noticed that, are there a lot of trials going on regarding this kind of medicine?
Yeah, so there is, and I actually reached out to the University of Miami Miller School of
Hmm.
Medicine. They're doing a lot of clinical trials with this. They have a stem cell institute that I am
Wow, cool.
involved with, and so I've spoken with them to. And I mean, obviously, the ideal would be to have clinical trials. So the issue is a lot of these clinics that do PRP, they're not regulated. They're doing the PRP in-house. You don't know how
Hmm.
they're centrifuging it, if it's even PRP, if it even works. With these clinical trials, the goal is to regulate it, have the FDA make sure what you're doing is correct and what we're doing is actually working.
Are there you know of many cases of doctors that are just making this kind of thing up, or like?
Oh yeah, I mean, I know doctors who are promising it cures erectile dysfunction, that it'll cure hair loss. We're putting it into the procedures. When you do fillers, a lot of it is PRP. It's safe, but it doesn't stay there very long. So anything that's cash pay, people will pay cash. There will be people who will accept the cash for it. So if you want
Right.
PRP for erectile dysfunction or hair loss, someone will do it for you.
What else? What other methods do you? I noticed that I wrote down that I didn't know what it meant, but peripheral nerve stimulator.
Yeah, that's a newer technology using an older known theory. So a lot of what we do in pain medicine is temporary. and you're just hiding masking pain, nerve ablations. You're just using heat to burn the nerve and it will regrow in a few months. Steroids are just calming down the inflammation. You're not really caught helping the root cause. Neither is the peripheral nerve stimulator, but the nerve stimulator is sending a small electrical signal to the nerve temporarily for
Oh,
6 months
cool.
maximum, and it resets the nerve to the point where it doesn't, hopefully, or it has been shown this by evidence, that it forgets about the pain. It resets it to its standard, to the normal nerve. A lot of chronic pain is where the body's tricked into thinking that you have a problem in your shoulder and your knee because you're missing cartilage, and the nerves are firing continuously because they're confused. They think you have a problem there when in fact it's an issue, but they're just constantly firing. And the idea with the peripheral nerve stimulator is you're resetting the nerve. You're tricking it and making it go back to its original state and not
That's so
recognizing this,
interesting.
yeah, stimulus as a nerve, as pain.
So it's almost like a guard dog that becomes familiar with you, and
Yeah,
then stops barking and jumping on you when you walk into the
exactly.
house.
And the peripheral nerve stimulator is not burning, it's not transecting, it's just providing a small signal to the nerve to reset it.
Gotcha. Does electroshock therapy work in a similar way?
Yeah, the spinal cord stimulator, is that what you're referring to? Like,
No, I know
oh, the
that people use
shockwave?
sound waves, shock waves.
Oh,
That's what I meant. Yeah,
yeah.
shock waves.
So
Yes.
the shockwave is also around restorative. The idea is it provides these shock waves that causes some tissue trauma. And a little bit of tissue trauma is good because in the areas like the fascia or the tendon, that trauma will cause some bruising, some bleeding. And with that bleeding, you get platelets and those growth factors to come to the area, which are
Oh,
otherwise
cool.
very hard to get to. You can't get those those growth factors to the area without a little bit of trauma. And so the idea is it's called in older terms prolotherapy, where you cause some it's counterintuitive. You cause some uh, damage to the area to
Mhm.
cause some bleeding and bruising, which brings growth factors to the area.
I think that the whole premise of vaccines is pretty similar. No, that you're
Yeah,
introducing
exactly.
that substance to your body for the body to respond to become familiar and respond to it.
Yeah, exactly.
That's cool. That's really cool. So that notion of introducing something to kind of introducing something on a smaller scale, that it's so funny because on like a social level we have that too. There's a book that I just mentioned even today on a different podcast called the Anxious Generation, and one of the things that he talks about is that when you're growing up for kids, that's important that they get into, he calls them scrapes not breaks.
Mhm.
That like they learn that falling is not a huge deal, but they also learn how to like that there's no consequences, and
Yeah,
that like they could just bounce back up and they'll be okay, and then they become more adept and more nimble and more, and kids become a little bit more confident when they're able to get up and kind of brush themselves off. But if you get a break, obviously it's a lot more significant.
exactly.
Um,
And like the shockwave itself doesn't cause any breaks. There's nothing that goes in the body. It just provides some gentle vibrations above the skin, and that breaks up the tissue enough to cause some
Yeah,
healing.
yeah. I think, well, I don't know. So I went to one of those IV bars one time in
Mhm.
Austin, and I sat down. Actually, so it's funny. I sold the guy an ultrasound machine, and then I happened to be visiting Austin, so I decided to stop by and check out what the place looked like. And he had me sit down in one of these chairs, and the chair would vibrate more intensely based on how tense my back or arms or whatever part of my body that
Mhm.
was sitting on the chair was. And then as my body got looser, the vibrations or as I guess it opened up a little bit, the vibrations would slow down until it would come to a stop completely. But you
Mhm.
didn't even realize how tense you were until that started.
Exactly.
Yeah, that's part of the whole treatment. When did you open Gables Paint?
So Gables Pain has actually been open. The LLC has been open since 2022, but
Nice.
my doors have only been open for 6 months because I've been not fighting, I've been trying to get on insurance contracts. Insurances are notoriously hard to
Hmm.
have you get on their panels, especially in large cities. They don't want to pay more doctors, obviously, despite there is always a need, especially in pain, but it's just hard to get on the insurance panels. So I finally got on most of them, not all of them, about 6, 7 months ago. So patients have been trickling in.
Wow. Interesting. What steps go? So at first, when did you want to open this up, and what steps go into opening your own clinic?
Honestly, pain, I decided to be on my own in pain medicine when I ended up talking to so many private equity firms who had bought up these small private pain clinics and wanted to hire me and work me, who knows for how many hours,
Yeah,
seeing
sure.
patients, doing procedures that I don't know if I even believed in. And the way I was treated, I didn't appreciate it at all. And
What they want you to do that you weren't sure you believed in?
uh, I mean, the issue is you don't have much say. You either accept what they want to do or you just don't do
You're
it.
gone. Yeah.
Yeah. So the reason a lot of it's really performance based. So the more patients you see, the more procedures you do, the more you get paid.
Yeah.
And I mean, obviously that's true for me too, but I'm not expected and held to a certain number of patients. I don't have to. I can practice medicine as I want to, and
Yeah.
evidence based. There's multiple examples. I think just the other day, there was a CEO of a pain clinic in Tennessee or Kentucky that they had, I think, 20 pain clinics. And he went to prison for 30 years for their use of injections. They were almost in 1 million injections in their patient in a year, which is
Whoa.
crazy amount.
That's
And so
staggering.
they were pretty much carrot and stick model. They were doing injections, which is how you get the most money. And the and to incentivize patients for that, you give them opioids. You pretty much get them addicted, and so you give them opioids, and it's like a handshake agreement. I'll give you opioids if you let me do injections on you. And so they were doing injections once every other week, which is
That
insane.
is crazy. This was in Tennessee?
This in Kentucky or Tennessee, I
Kentucky?
just saw,
Oh man.
and
And
so
I feel like the opioid conversation has really blown up so much that I'm shocked that it's still happening on the scale that it is.
yeah, it's just it has a place. For instance, today I had a patient who had severe back pain. He
Hmm.
cannot almost perform any activity. And so I will do it for a short course to really maybe 10 days of a Percocet
Yeah.
just to get him past the hump, but I don't do more than that. And if I
Yeah,
need to do
I
long
agree
term,
that of course everything has a place and time, you know. It's
yeah,
sure, but the obvious conflicts of interest and the obvious advantage that people could be, you know, that people could people could get taken advantage of pretty seriously, you know.
yeah.
Especially because we trust our doc. Like we trust our doctors with everything. You know, I was talking to
Mhm.
someone this past weekend, and there, you know, there were he just he just had a kid, and he was telling me how how they wanted to put this cream in the baby's eyes in case I forgot what it was for exactly after the baby was born, and he was asking the doctor about it, and like her response to him was like. He just wanted to know what it was. He didn't know what it was. And she's like, "Don't be one of those people. Just do it. You want your kid to be blind?" And like, he's like, "No, sorry." And like, he like looked into it after. He's like, "I totally didn't need to do that," you know. But
Yeah,
you know, I think people, you know, you put on a coat, you put on scrubs, you put on, you know, the mask, and you walk in, and you're the figure of authority that knows, and everyone kind of just and by the way, in an ideal case, that should be the best thing in the entire world because ideally. There is no taking advantage of people, and ideally, you know, you don't want to do that, you know, and like what you do, you go, okay, you know, I'll do 10 days to hold you over, but you can't go more than that because you know, literally 30% chance you get addicted to these, you know, I mean, is it
yeah.
worth it? You know, um, it's an interesting dynamic. It's so interesting that the abuse is still going on so strongly, though. It's hard to fight it, though.
It's very, I mean, opioids are is the most addictive substance on earth up there with
It's crazy.
methamphetamine and opioids. I don't think. I think methamphetamine might be one a little bit more addictive, but
Yeah.
Opioids are very
Yeah,
addictive.
yeah. I hope we turn to current. I hope we turn. I think like with the Netflix documentaries and the books, like I just read a book called American Cartel about the DEA trying to trying to sue. Basically, I think one of the harder things about the opioids is it's hard to figure out who to point the blame to. Do you point the blame to the doctors? Do you point the blame to the manufacturers? Do you point the blame to the people that are providing it, to the corporations that provide incentives and kickbacks, and like say you're the problem, or do you say to the middlemen, like the Walgreens or the CVS's, hey, did you notice that one person's getting X amount of prescriptions picked up, and like that's not normal? It's like, well, it's a doctor. That's what they told me. So like it's everyone has plausible deniability along the way, which makes it so much harder to kind
Yeah.
of crack down.
No, exactly. And I mean, I talked about private equity, but I know a lot of private paying doctors who went to jail for life because they just want to give these opioids indiscriminately because they're making a lot of money. And so the blame is on I mean, on everybody. You can't, I mean, common sense, if I'm giving DuPont Industries, the ones who made OxyContin, said it
Yeah,
was not
that's right.
addictive. Fine, that's fine. They're gonna come to you and tell you, give me put all your patients on this. And if they start dying, I mean, you gotta stop using the medicine. And we see them, patients are dying all the time from these opioids. Just stop. It's greed everywhere. That's what it
Yeah.
is.
Yeah. What new developments are you keeping your eye on, or that you're keeping track of, that you're excited about in terms of chronic medicine and
Well,
regeneration?
it's not chronic yet, but a new drug called Jornavix just got FDA approved in January.
Okay, what is
And it
that?
uses sodium channels and it's non-opioid based. It's right now it's used for post-surgical pain.
No
And
way.
patients take it after surgery, and it significantly reduces the amount of pain they feel.
How does it
And
work?
I think it's only a matter of time until it goes into the chronic pain world. But it's a fantastic drug that was just approved this year, and it uses a novel receptor, a sodium receptor, that really targets nerves specifically.
What is what is what you say sodium? Is it sodium?
Yeah, sodium channel. So our nerves work by they use sodium and potassium to move the signal, move the polarization, the charge, and if you can just mess with the some way they've altered the way the nerve responds. Lidocaine, for instance, is a sodium channel receptor blocker.
Okay.
It affects the sodium channel. So Jornavix works in a similar way, but obviously longer term and slightly different.
Right, right. Wow. And I guess you don't have any of the side effects or addictive nature to that.
No, yeah, not
Wow.
like
Have you been prescribing it?
no, because that's prescribed by surgeons. It's acute pain, so
Okay.
I don't deal with acute pain. For me, chronic pain is anything over 3 months.
Oh, interesting. Gotcha. Gotcha. But okay. Would you use that as one of the holdover acute pain like prescriptions that you'd write instead of an opioid?
Um,
Like for the
no,
10 days or week or whatever?
no, because it hasn't been FDA approved for that. It's approved for really specifically right now for surgical pain.
I see.
It doesn't mean it can't be, but it just doesn't have enough studies to kind of the word I'm looking for is
Confidence?
warrant
Oh,
its
warrants.
use
Nice.
in chronic pain yet. There's not
I
enough
gotcha.
studies yet.
I gotcha. But you're excited about it. You think that'll be good.
Yeah.
That's awesome. That's awesome. How do you keep up to date how much time do you spend researching?
Um, I actually try to do recently, I try to do an hour a day of either learning whether it's new ultrasound guided methods. I ask ChatGPT a lot just because there's so much information. There's a ChatGPT for science where you can ask it new developments and to summarize the new developments. I do
Cool.
that a lot. And
Cool.
then depending on what it tells me, I'll go read about it more. There's a
Hmm.
pain journal, there's anesthesia journals. But I really like the meta-analysis that's provided by AI.
Right.
It's succinct and it can tell me the evidence based off all the studies out there. So
Right.
yeah.
Right. Right. So you opened your doors about 6 months ago.
Yeah.
So you had to get a lease, I figure, right?
So the reason I chose Vegas or Miami is because my friend from Las Vegas, who's an internist, has a clinic here in Miami, and he
Nice.
asked me to set it up, and so
Cool.
I pay a sublease to him, so I don't
Okay.
have to pay worry about the lease. It's much more economical, and it gives me just a way to get started slowly.
Awesome.
And so I use some of his staff. Um, I mean, I'm a separate entity, but I can just I'm Gables Pain, he's Gables Medical, so we just kind of piggyback off each other.
Awesome. 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 I'm assuming you get a lot of foot traffic and crossover
Yeah.
patients from one another, right? That's really, really cool. Tell me about salsa dancing.
So also, I'm a very active person. I have a hard time watching television and playing video games. So I picked up
That's good.
salsa dancing maybe 8 years ago, and I play soccer. I do a lot of stuff just to stay active. I just
Gotcha.
stay active.
And what about well, yeah, but dancing in particular is like a phenomenal workout, right?
I think if you're much better at it, yeah. I'm not at the level where it's exerting me physically, but it's exerting me mentally to count steps and to figure out to keep my arms. So no, I can't say it's a good workout yet.
No, not yet, but it's more it's fun.
I will be a little bit like maybe a bit sweaty, not nothing like a workout though.
Gotcha, gotcha, gotcha. And what about diet? What about your diet? How much attention do you pay to that?
Diet, I try to eat a balanced diet. I have a fast metabolism. I don't have to worry about um, I still worry about eating right, but in terms of diet, I eat most of my meals. My breakfast is usually yogurt and granola with fruit and boiled eggs. My lunch is my biggest meal of the day, and I stop eating after five or six, just
Really, you don't
because
eat
it
anything.
doesn't sit well with me. I don't like waking up with this feeling of just being full. So I eat real two full meals a day and a small dinner. And
Yeah. That's awesome. That's awesome. Have you ever looked in, have you done homework into the association between the between diet and inflammation and especially chronic inflammation?
yeah, and I believe it. I think the more, if we can just eat a more organic diet with less preservatives, a lot of these preservatives aren't good for our bodies. And I think we've seen that other countries have much healthier diets.
Mm.
My family's Italian, and they have a much cleaner diet. The Mediterranean diet, very healthy. My grandmother is 100 years old, living by herself.
No way.
I'm
Get
going to
out of
see her.
here.
I'm going to go
God
see
bless
her
her.
next month to celebrate her birthday. But my point is
Where does she live?
in Genoa, in Liguria, in
Cool.
northwest Italy. So my point, the diets that are cleaner, Okinawa in Japan, they've shown that those diets that are fish-based, plant-based, they're less inflammatory. You create less reactive oxygen species. So it's
I've been noticing, and I think that's what part of what's been exciting to me. Um, there's certain things I feel like you can see and tell that like culture and society is changing despite what the news or whatever tells you. And I think that there's certain like markers or indications. So I've noticed recently that when I go to Costco, that a lot of the snacks are being advertised or actually being, healthier with 5 or 6 ingredients. They opt out of using, a lot of times they'll opt out of using seed oils or emphasize that they're using olive oil or avocado or something like that. And what makes me excited about that is that no one's Costco's not in the business of just doing what's politically correct. They're in the business of making money and
Mhm.
giving people what they want to buy. And like if that's what's moving off the shelves, and if the other stuff is just kind of like laying around and they're incentivized to swap it over, you see it with everything. You see it with cheese, you see it with meat, you see it with snacks, you see it with eggs, you see it with milk. Everyone just like it just feels like there's just a mass awareness that like the food that we're eating has been, it has to be a little better. And then it's trickling down not just to the Whole Foods and not just to the Trader Joe's or I guess Trader Joe's isn't so expensive, but it's going to places where everyone goes. Costco is where you go with a family. That's where you go, to shop for 10 people. So I think that it's a really exciting time that shows that we care about what we're putting into our bodies, and that's really exciting.
Yeah, I know. That's true. But I also think The flip side is I think that a major issue in our society right now is mental health and physical health, obesity. Obesity,
Oh yeah.
70% of our population now is obese or overweight.
Yeah. I went to the doctor a year and a half ago, and they told I'm closer to 6'4" than 6'3", and I was 224,
Mhm.
right? And the doctor's like, "You're right on the line of overweight." Is what they told me, uh, and like I went home and I was like, I never thought I was going to be that guy that was on the line of overweight, and I was like, I got to get myself together, and um I'm not that anymore, thankfully. Um, but it started. It just like I just needed a little bit of a wake up call where I just went to the doctor and they're like, "Listen, man, like that craft beer that you have there is going to kill you." And I was like, "Yeah, if it's not going to kill me, it's going to give me diabetes, dude." There's a brewery I go to that they used to they changed it since, but they used to put the amount of calories in the pour that you're going to get.
Mhm.
Um, and a stout, a dark beer that's 10, 12%, it would have 400 or 500 calories in a 4-ounce pour.
Yeah, it's a lot. And
It's
people
crazy.
having multiple beers, not just one.
Oh, sure. Yeah. I mean, I tell you from my own experience,
Yeah.
definitely. Um, but yeah, I'm really excited. So what do you hope is next? So you're in this place, ideally in a year or 5 or 10 from now. Where do you think you'll be?
So I always tell people I don't know where the clinic is going. I can't tell. I want to be I want to do cool things with cool people, meaning I want to be able to offer these new therapies. I want to offer the bread and butter therapies safely, and I want to have a comfortable and exceptional patient experience, which I can offer now. But I want to work more, like I mentioned, I'm working with the University of Miami Miller School of Medicine. I want to be able to have clinical trials where we're advancing this field of regenerative medicine, where we can safely offer these therapies that right now are promised in the community at large falsely. I want to be able to offer them safely and with evidence. And I want to say, I want to guarantee, and I can say with confidence that they will regenerate this or they will help your pain. And we can offer that. And I think that if I can do that and be part of that, I'd feel honored.
I'm really excited to see where you're going to be in, like I'm really excited to see where you're going to be in a year or 2 or 3. Just like sniffing around and following what's interesting and, and kind of pursuing it because that's where all the groundbreaking and interesting stuff is, and, I hope that when that happens, you either call me for equipment or for another podcast because we could talk about what the update's going to be. But this sounds really, really cool, dude. This has been so much fun and so informative. I really appreciate you taking the time.
Yeah, 100%. I definitely would appreciate talking again, and I appreciate you inviting me on here.
Yeah,
I
dude, of
don't do many
course.
podcasts, I don't get many invites, but I've done a few, and this has been the best one.
Oh man, you know what? We'll see when you do a couple more whether you still say that again.
Yeah,
All right, Doctor, I really appreciate it. Thanks so much,
yeah, you're
and
welcome.
we'll be in touch. I'll talk to you soon. Have a good night.
Yeah.